Welcome, everyone. My name is Elian Ramos, and I'm your host tonight. Tonight, we're going to be talking about, of course, the countdown to the February 15th deadline for the Affordable Care Act enrollment period. And as we know, several studies have pointed out that Latinos have a high propensity to different illnesses like diabetes, ovarian cancer, high blood pressure, and that means that for us it's very essential to have preventive care and health insurance. And so what we're seeing is that a year after the Affordable Care Act first enrollment period, the numbers of the overall insurance rate, uninsured rates for Latinos have gone down considerably. It has dropped from 36% of uninsured Latinos to 23% in 1 year. And so although these numbers are very encouraging, they also mean that there's a lot of more work to do. And there are efforts all over the country, especially now with the deadline that is approaching on February 15th. And so tonight I have with me two of the people that are leading those efforts all over the country. I'm talking about first Jose Plaza, who is the Director of Latino Engagement at Enroll America. How are you, Jose?
I'm doing well. Thank you for having us.
Thank you for being here. And I also have Elizabeth Perez, who is the Public Health Advisor at the Substance Abuse and Mental Health Services Administration. How are you, Elizabeth?
I'm good. So happy to be joining you.
Are you guys excited about the deadline?
We are excited, and we are counting down. February 15th is around the corner, and we're trying to figure it out.
So let's start with you, Elizabeth, since you already started the conversation. Why is healthcare such a big deal for Latinos? Why is it so important that we get covered?
So, out of all the populations, and even though a lot of Latinos have gotten covered, Latinos still have the highest uninsured rate out of all groups. There are many health disparities that affect the Latino community, ranging from obesity, cancer, asthma, liver disease, diabetes, and mental illness. So I'm just going to give you some facts that people tend to forget about the health of the Latino community. Hispanic men and women are twice as likely to die from liver cancer. Hispanic women are 2 times more likely than their white counterparts to have stomach cancer. Hispanic women are twice as likely to have cervical cancer and to die from it than white women. Puerto Rican children are 3 times more likely to have asthma compared to non-Hispanic whites. Hispanic children are 40 times more likely to die from asthma compared to non-Hispanic whites. Among the Hispanic and Latino population, chronic liver disease is the leading cause of death, and it can be exacerbated by conditions including alcoholism, diabetes, obesity, and exposure to hepatitis. Hispanics are more likely than non-Hispanic whites to be diagnosed by diabetes, and they have a high rate of renal disease caused by diabetes, and 50% more likely to die from diabetes compared to the white counterparts. And it doesn't stop there. Hispanic are twice as likely to die from viral hepatitis, have the second highest rate of hepatitis A. Puerto Rican Americans have a 40% higher infant mortality rate compared to non-Hispanic whites. And when we get into mental illness, poverty obviously affects mental health status. Hispanics living below the poverty level compared to Hispanics that don't are 3 times more likely to report psychological distress. The suicide rate for Hispanic girls aged from grades 9 to 12, they're 70% more likely to have suicide attempts compared to their white counterparts. Mexican Americans are more likely to be overweight and obese compared to their non-Hispanic counterparts. And so the list goes on and on and on. So what do we have learned from this? One, your health is so important. You need to be healthy not only for yourself, but also for your family. Here's the silver lining in all this. One, a lot of these conditions, along with a good diet and exercise, are preventable with routine health care. And for those that are not, having the ability to see a health care provider at the early onset of disease makes a huge difference on the outcome. So this is a lot of the reasons on why Latinos need to get insured, and they need to have access to insurance, so that way we can see, as we start to grow older, these conditions decrease.
I think I lost you a little bit there at the end, but those are astonishing statistics, and I know I'm gonna switch to Jose now, because I know that your organization, Jose, has been leading efforts across the country, and I hear all of these disparities in the community, and I hear that the numbers are changing. So, in your opinion, in your experience, what have been the messages that have been resonating the most in the community, the ones that are working in making people want to enroll?
Thank you, Elian. And Elizabeth, I think every statistic that you touched upon is a reason why Latinos need to get enrolled in the ACA. But more so, this campaign, I've always said it from the beginning, that this campaign is about awareness and knowledge within the Latino community of the benefits of this law. And a lot of these benefits are the cause for prevention of many leading deaths in the Latino community. And so that is really our key message when getting out there to the Latino community, is creating awareness about the benefits, creating awareness about the resources that are available for Latinos, such as in-person assistance. Financial assistance is another big thing. Latinos tend to think that they cannot afford health coverage, but in reality, there's more assistance out there for Latinos because of income, because of where in the country we are at. Folks can get health coverage for less than $100. That's less than their cell phone bill. So we have to work to get that message out. We've worked with social media, efforts like these with Elian, Twitter chats, working with traditional media to get to Latinos that still watch television, that still read the newspaper. The message is key, and we have to let them know that the benefits for ACA really stand to gain for the Latino community the most, not only because of all these health disparities, but because of the reality of our income and where we tend to live in the country.
Yeah, so what I'm hearing is that it's a combination of efforts in different media, but also sharing information on like statistics, like what Elizabeth was sharing before. And I also think, and this is just maybe my own opinion, but I believe that also hearing success stories or stories of of people who have overcome the disparities are also very powerful. And Elizabeth, I want to turn to you now, because I know that your story is pretty powerful. You shared that with me on my blog a couple of weeks ago. And can you tell us a little bit about the story for those people who haven't heard it? And what do you learn from it? What, anyone?
So, yeah, so a lot of people, when I tell my story, tend to get very surprised that it is a real story. And that's one of the reasons why the ACA is so important for me. But it speaks to two sides. One, it talks about the benefits of the Affordable Care Act, and the other one talks to all those young invincibles out there. So my story goes, a few years ago, I was also a young invincible. Not to say that I'm not anymore, but I was also one of those people that was very active, and I'm still active. So, I had played soccer, I was running a lot, and I was in college, and just by being active, I started to have this pain in my knee, and, I kind of, like most people, oh, it's not a big deal, I'll just stretch, I'll just keep going, and, I eventually let it carry on a little too much, to the point that I couldn't do the normal things that I was doing without having a lot of pain. The fortunate thing was that I did have health insurance at that time. So I had went in, seen my doctor, I got into an orthopedic surgeon, found out that I had torn my meniscus and I needed to have surgery on my knee. So, for months I went through this process. I got my, my x-rays, I got my MRIs, I got my pre-op appointment. I had went through months and months of appointments and through a whole rigorous chain of events to lead up to my surgery. So, I had my surgery. After I had my surgery, I went through months in the physical therapy. And then what happened was 9 months after my surgery, okay, 9 months, I get a call from the hospital saying, hey, you owe us $15,000, and that's just for the bill for your doctor. And I
Right.
said, for my surgeon, and I said, what do you mean? Like, I have health insurance. I went through the pre-op. I went through an authorization. What do you mean I owe you money? And so they told me, well, your health insurance rescinded. So essentially, they went back and took back the payment and pretty much left me with the bill. And before the Affordable Care Act got enacted, health insurances did do this, and they were very within their rights to do that. And it just didn't expend. It just went far beyond even me and my own series. It was people that had cancer. And so my story is the same story as millions of other people out there. I had health insurance. I went through the right process. I got authorized, and by some loophole, they took back the payment. So here's the moral of the story. One, you may be young and invincible, but that does not mean that you're not going to get sick at one point or another. For a lot of young people, sports accidents is one of the leading causes that they go into emergency room, sprains and broken bones. The other thing is the benefits to the Affordable Care Act. The Affordable Care Act gave us tons of consumer protections that we didn't have before. Insurances can no longer rescind their payment. They can't come back and look for this loophole and say, we're no longer going to pay for that. They can no longer say, you know what, your surgery or your cancer treatment's too much, we're no longer going to pay for that. So there are so many consumer protections, I think, that we took for granted that now that we have, that we should be able to use. So here's the things that you need to remember. If you're under the age of 26, you can be enrolled into your parents' plan now thanks to the Affordable Care Act. And for those under the age of 30 who can get in hardship, or if you can over the age of 30 that can get in hardship, you can also get what we call a catastrophic health plan, which gives you some of the same benefits. However, there are some limitations. But now there's no more reason on why you cannot afford health insurance, because it is guaranteed at one point or another. May not be today, may not be tomorrow, may not be next week, but you're going to get sick. And it may not be something like me needing surgery. It could be the flu. It can be strep throat. It can be so many things. So you're going to get sick, and you're going to access the healthcare system.
Yeah. Oh my God, I cannot even imagine how scary that must be, because, you did do everything right? And thank God that now all of those things are covered, all of those protections are in place to help people avoid those kind of situations. So we have the enrollment deadline coming up this weekend, on Sunday to be exact. And so what are some of the things that people need to keep in mind to know so that they can get ready for Sunday to beat the deadline? And this is a question for both of you, so whichever one of you wants to jump in.
Well, I think one of the most important things that folks have to remember is that in-person assistance is available. As you mentioned, we at Get Covered America, we're hosting events across the country that are bilingual, and they're going on all day. So, folks, if you have any type of reservation for going online or calling the 1-800 number, you can always go and find local help. As well, one of the more important things is that there is a fee attached to this. If you don't take advantage of this healthcare law, there is a fee of $325 per eligible person in the household, or 2% of your income, whichever is higher. And as Elizabeth was mentioning, getting injured can sometimes be devastating, even more so than not having health insurance. Healthcare costs are the #1 reason for bankruptcy for Americans in this country. And so if you're vacillating between getting coverage because you think $50 or $60 a month is expensive, imagine getting that $15,000 bill and having to pay when you could have had gotten covered, even under a catastrophic plan. So it's important for folks to remember that the deadline is this Sunday, that there is financial help available. Also, if you happen to start the application and you don't finish it, go back. There is assistance there in 50 languages, 24 hours a day. And I can share the phone number. It's 1-800-318-2596 for folks to call. And you can also go to cuidadodesalud.gov if you have family members that don't speak Spanish, that don't speak English, and need assistance in Spanish. So just remember those things, the deadline, that there is financial help available, and that if you want in-person help because you happen to be in a mixed status home, if you have, grandma and aunt living with you, and so your tax filing is a little bit different, go talk to a counselor in person, and we have all those events available at gcaconnector.org, or you can also go to the HHS website to find local help.
Awesome. And Jose, just to clarify a little bit, that you mentioned that there's a penalty, and who is the penalty for?
So the penalty is for all those that are eligible to receive assistance from Obamacare or the new healthcare law, and the penalty is $325 or 2% of your income. So a lot of folks are thinking, last year was $95. So a lot of folks thought like, oh, I'll just be sure and pay the fine. And we don't want to push the fine as the reason why you should get covered, because as I mentioned, if something, knock on wood, that doesn't happen and you do end up getting sick, you're likely to see a bill for higher than $325. Just medication alone could be all that. If you're a new parent, if you just got married, if you lost your job, those are all reasons that you should look into getting coverage, because at the end of the day, you just want to be self-assured that your health will be in place.
Yeah, that's very important. And I know that a lot of people have questions out there about the financial aspects of this. Obviously this is a concern for the community. And I actually have a question from the audience. I have a question from Sylvia Torres via Facebook that has to do with the financial aspects. We know that tax season is upon us, is coming up in the next couple of months. And so her question is getting health insurance going to affect my taxes? And what do I need to know to get ready?
So if you did get a subsidy on the marketplace, you're going to be given, you should have already gotten, if not, get a form within the next, I'd say maybe a week and a half or two. It's the 1095A form, in which you will need to take to your tax person and say, hey, I did get subsidies, I was eligible for health care. So there is a form that you will get. For those that did not get coverage in 2014, you have to, when you file for your taxes, you have to prove that you have an exemption. So in order to get an exemption, you have to fill out the paperwork and file it. That information can be found on healthcare.gov, and there's a whole list of reasons on why you can be exempt, ranging from anyone who didn't have health insurance for like a month or two, if you were from a federally recognized tribe, if you're not filing health insurance, if your plan through your work did not meet the threshold, if you're part of a healthcare ministry, religious reasons. So there's a whole reason, and then there's also hardship exemptions. So if you go on to healthcare.gov, there's a whole, you can find the form there, and there's a whole list of reasons on why you might qualify for an exemption. But you are going to need to show that you had health care, or you are going to get that penalty. And like Jose said, there's that the penalty is goes 2% or $300 but it goes up every year. That's something that people need to keep in mind, is that every year it's going to get more and more expensive. So you don't have health if you don't have health insurance.
Yeah, well, and I mean, it's all a little complicated, but you're going to be getting your forms on the mail, and then you take it to your tax preparer, and then if you didn't get insurance, then you're gonna have to discuss it with the tax preparer too, and find out if you have an exemption.
Yeah, and either which way, if you go to a tax preparer or if you do your taxes online through TurboTax or H&R Block or whomever, there are questions now that are part of your taxes that you will have to answer. I just did my taxes a few days ago, and it definitely did pop up. So don't think you're going to be able to avoid this. It is part of the new tax filing system.
Awesome. Well, that's good to know. So continue.
Well, Eliane, just one more thing is that if you did get a subsidy or you did get some kind of benefit through the marketplace, if you do not get that form, make sure you call at 1-800-318-2596 and request that form, because you are going to need that form.
Okay, that's good to know. That's good to know. And what is the number again? Can you repeat it, please?
It's 1-800-318-2596.
Thank you. So let's continue under the same vein of financial questions that people may have. One of the biggest worries is, as we mentioned before, the not being able to afford health insurance. Is there any kind of financial aid available? How does one find out if one qualifies for that aid?
So if you go on healthcare.gov, there is a calculator and it gives you a whole range of subsidies and tax that you can be eligible for. People need to know there is financial assistance available to you. Individuals with an income of up to $46,000 and families with an income up to $127,000 are eligible for either Medicaid, lower health premiums, and or lower out-of-pocket costs. Here's the other thing that people need to remember, because there is this fear about mixed status families. If you are from a mixed status family, you can, if you are eligible for tax benefit in your state, you can get that tax benefit for the person that is eligible for health care. So if you come from a mixed status family, you should not be afraid to apply for health care. And you may be eligible for financial assistance for the individual that is eligible for health care.
Mm-hmm. And it's also important to remember that this information that you share with the health department is not going to be shared with any other agency. And so for people who have that worry because they have a mixed status family, they don't need to worry. This is confidential information that's only going to be used for the health insurance purposes. So Jose, let's go back to you. I know that you've been all over the country. I mean, every time I see you on Facebook, you're like off somewhere to some other beautiful location. So where are you going to be holding events now leading up to the enrollment deadline this weekend?
So we at Enroll America, we have offices and staff in over 11 states. So everywhere from New Jersey to Philadelphia to Illinois to Texas, where I will be this week in Houston. So if you're in Houston, come and find me so we can help you get enrolled. So we're hosting events everywhere from universities to community centers. We're doing a big event in San Antonio at San Antonio College. We're working with hospitals, with clinics. You name it, we're there. We're bringing service and information to the Latino community where they are at. And also, if, like I mentioned, if you need help, and going back real quick to this idea of financial help, you can always go window shopping. Just as you're doing at the mall, go and window shop for different plans, see what fits your budget. But also, more importantly, HHS just released this number that on average about $250 folks are receiving in subsidies, and so it's important for folks to be able to get this assistance, from the government. So, like I said, if you can't go to an in-person event, you can always also go to cuidadosalud.gov or as well to healthcare.gov or call the 1-800 number that we shared earlier. There shouldn't be an excuse why you and your family doesn't get enrolled, because we are providing pretty much every single recourse that you might have.
And, as mentioned, there's 4 ways to enroll. One would be on the website, healthcare.gov for Cuidado Salud. One would be through calling over the 1-800 number, which is open 24/7, 365 days a week, and has multiple languages. It's 1-800-318-2596. You can also enroll by going to a local event. If you go on healthcare.gov, you put in local event. You can find enrollment events in your area. In addition, you can do it by mail.
Mm-hmm. And if you go right now, if you're watching this on Google Plus, you can see all of these different websites highlighted. They're part of the showcase that we have on the show, so you can get them there. And I'm also going to be listing all of them on my website. So let's Jose, going back to you, where can people RSVP for these events that you're having all over the country?
So we actually have this really cool tool. I'm a huge fan of it. I push it every time I get. It's called gcaconnector.org. We're hosting events, like I mentioned, across the country, and sometimes folks can't, go to a big event on a Saturday, or you work, and so you come home late. So if you go to this connector, as we're calling it, gcaconnector.org, you can type in your zip code and language preference, and it'll give you counselors and assisters in the 25-mile radius of where you're at. You can choose as small as 5 miles or as big as 25 miles. And just as you would make an appointment with the doctor, you can make an appointment between now and Sunday to go see someone, and it'll give you the times available. You pick whatever is best for you, and go see a counselor, so you don't have to wait in line, or have to go online and call someone, so you can see someone in person. So again, that's gcaconnector.org. And if you want to go through Cuidado de Salud, or as Elizabeth mentioned, healthcare.gov/local help, that's also really helpful. There's events from different partners that are going on across the country, so we just want to make sure that you get out there.
I will say that if because we like to enroll, most people like to enroll in person, but if you're going to enroll in person, I think that you should make sure that you have all your paperwork ready, so that way you maximize the time that you're there. So I don't know, Jose, since you guys are on the ground, you might want to mention the paperwork that people are going to need as they show up.
Sure. So you need to bring identification. This is any type of legal identification that proves your residency here in the country. You need to bring proof of income with you. That can be a check stub, your W-2s if you've already gotten them back. If you lost your job, still bring them so that they can verify your identity. And with these documents, you can then prove who you are, so that when the navigator helps you, they'll be able to locate you. And if you have a family or a spouse or children that you're going to be enrolling, they don't necessarily need to come with you if they're at work or whatnot. Just bring with you their social security numbers, and they'll be able to locate them as well. So those 3 key documents are important for you to bring, so that they identify who you are, and then they're able to assess what kind of assistance you can get from the government.
Awesome. Well, I wish I could go with you to Texas.
I want to go to warmer climate.
Yeah, I know it's warm in Texas. It's freezing here. So before we go, because I know we're cutting a little close here, what would you say to people who don't think they have to cover that? I don't have anything to do with this. I don't want it. What would you say to these people to convince them that they should?
Well, I would say is that get covered, because your health is so important. Until you don't have your health, then you don't realize how precious it is. It affects your livelihood, whether you can go to work. It affects what you can do for your family. So that is the one thing that I would say, is that you need your health, and it is something that you can take care of. And by going to the doctor, you should, let's be realistic. Who doesn't want to have health insurance? Who does not want to have access to see the doctor? Who doesn't want to be healthy? Those are all things that we do want. So I will definitely say that and we all know someone who's uninsured. So if you are uninsured, or if you know someone who's uninsured, make sure that you go ahead and get them covered. SAMHSA does have a whole wide range of resources that are available. Behavioral health is one of those things that's kind of tricky when it comes to a lot of racial and ethnic groups, especially Latinos, and the ACA expanded eligibility for behavioral health coverage, which is one of the great benefits to it. But SAMHSA has stuff, and we will tweet that out at samhsa.gov. It's samhsa.gov. Sorry. But we have a lot of things for the Latino community. So how you work with talking about behavioral health in Latinos and enrolling people who have behavioral health illnesses, and working with those communities are Latino. We talk about on samhsa.gov, we have resources on our Office of Behavioral Health Equity, resources on Latinos and immigrants, things that they need to know. Enroll. We have a lot of webinars. We have a lot of toolkits. There's a whole wide range of resources that we have. So SAMHSA.gov has tons of resources for Latinos and working with individuals in the behavioral health community. We also, I would say, resources at healthcare.gov has a lot of information there for you to look and just get your questions answered. Most importantly, you can go call the 1-800 number, talk to someone. If you need information, go there. There's local help. Talk to a navigator. America, go there. Find. There's no reason we have a lot of resources for you. There is no reason why you cannot get insured. So we have given you the stuff. Now it's your job to make sure that you go and get enrolled.
Get and do it. Jose.
Well, just the same thing, reiterating the fact that it's not until you get sick and you have to go to the ER and you can't go to work or you can't go to school. It's until then that we wish we had coverage. And for those that have gone through that, it's not a fun experience to be sick and not be making a paycheck. So avoid that, I think. As we opened up, this Google Hangout with statistics, there's a lot of preventative benefits to the ACA. So if you know someone that has diabetes, that has arthritis, that even is overweight, there's a lot of health concerns that come with the Latino community, and so the ACA really was made for Latinos because we are the #1 group of all ethnic groups that is the most uninsured, but that also has some crazy health disparities that the ACA can actually help mitigate. So if you have coworkers, if you have friends, I know that young Latinos, we actually made a really good dent in getting coverage, but there's still millions of Latinos that need this coverage. If you come from a mixed status family, don't let that scare you. If you have one parent or if one of your siblings isn't documented, be sure to get the rest of the siblings covered. And for those that are undocumented, there are resources in the community. Community health centers are there. The federal government is also providing more funds to provide services for those. So, just be sure to get the word out. Sunday is a deadline. Go get enrolled, or at the minimum, start the application so that you're able to find out prices and make an informed decision.
Do not wait to the last minute and have there's going to be tons of people that are going to be online and calling. Make sure you do it early as soon as possible. Do not wait till last minute. And
come on, we're Latinos.
exactly why I said
We've had 3 months. It's time to do it.
You know what, Elian? Here's the other thing: is I had worked in the healthcare industry for a long time. You're absolutely right. You go to the ER, you're walking out with a very hefty bill. But one of the things that Latino community does that we tend to forget is that health insurance in the U.S. is very different. In Latin American communities, health insurance is a foreign object. It's a foreign thing, and we can go to a doctor and pay, see the doctor, for $40 a year and go on our way. But $40 in the Latin American country goes a long way.
Yeah.
$40 here does not go that far. You're just seeing a regular doctor is going to cost you more than $40. And I know because I too, my family wasn't insured when I was younger. My parents had taken me across the border. I'd seen the doctor when we didn't have insurance. So I know how that works. So there are people who think, what do I need health insurance? Why am I going to pay every month? Because the difference is here, if you go to the doctor, we're talking hundreds and thousands of dollars. We're not talking about $40, $50, $60 that you might be able to pay to go see the doctor, across the border. So keep that in mind, is that you have people who tend to still, think, oh, it's not that big of a deal, but it is a big deal. And until you get that medical bill, you're going to realize how much more it's a bill. And for that price that you're going to pay, you could have already had health insurance.
Exactly. So we run out of time, but I want to leave everyone with the fact that they should be following your organizations to get more information about how to enroll. The deadline is coming right up. It's this Sunday on the 15th of February. So all the information that you can get before then, get ready and go. Don't wait until the last minute. All of the websites are showing up on the screen if you're on Google+. If you're not, the main websites that you need to pay attention to are healthcare.gov and cuidadodesalud.gov for Spanish. All of the other ones, follow the enrollamerica.org and sansa.gov. And one last thought before I leave is, just remember what our abuelitas used to say. You know, I always go back to the abuela because she's the centerpiece of the family, you know, and if you remember, she always used to say, you know, sin la salud no hay nada, sin la salud no hay nada. Without health, you have nothing. So please take care of yourself, get enrolled, get covered before the deadline this Sunday. I want to thank Jose and Elizabeth. Thank you so much for sharing all this information, so important for our community, and thank you all for watching tonight. I see you next week.
Bye.
Night.
Good night.
Good night.